Why am I balding? Hi, I'm The Rock, and I've gotten so bald you can always see what's on my mind. And today, that's alopecia areata, or AA. Before I begin my lip sync battle, I wanted to take this moment to talk to you about the very real issue I'm dealing with. It all became clear to me after my visit to my doctor. After this meeting, this form of balding, more commonly known as AA, became much clearer to me, and I hope today it will be clearer to you as well. So just what is AA and who does it affect? AA is a disease that targets growing hair follicles. It causes the hair follicles to fall out in round patches on the scalp and other places in the body. It's an autoimmune disease, which means that the immune system mistakenly attacks itself. The affected hair follicles become small and slow down hair production. However, the stem cells that continuously supply the follicle with new cells are not degraded by the immune system, and therefore, the potential is always there to regrow hair. Great, right? AA affects both sexes equally, and it occurs early in life or even in adulthood. The proportion of the American population that have AA is 0.1%, and the risk of getting it in your lifetime is 1.7%. So hey, I guess I'm pretty unique. If you have a close family member with the disease, your risk of developing it is slightly increased. However, the majority of AA cases are sporadic, and the frequency of getting AA due to genetics varies from 3 all the way up to 42%. How is AA diagnosed, and what the heck causes it? Let's explore. I remember being in denial of my balding head for so long. I'd continue to visit my barber and ask for a haircut, until one day he asked me, which one? I know, gutless, right? Anyways, AA is commonly diagnosed by taking a scalp biopsy. Now this sounds scary even for me, but all the doctors do is cut a small circle around a hair follicle and remove the surrounding skin. But don't worry, you can't feel a thing because they use a local anesthetic which numbs the area before they analyze. They take a biopsy to look at the structure of the hair follicles. The hair follicles contain stem cells. These cells are the ones that actually make your hair grow. Doctors then look to see if there's damage, abnormalities, or inflammation. They may also ask you to document your hair loss, when, where, and how much you lost. Doctors will also conduct a series of blood tests to rule out other disorders, such as thyroid disease. So what exactly causes this hair follicle abnormality? Your own body. Pretty wild, right? Because it's an autoimmune disease, the body in a sense turns on itself and ultimately attacks the hair follicles. It has been suggested that a gene therapy may be responsible for this hair loss, specifically SOX21, and no, not the ones on your feet. Without this gene, the hair isn't anchored in the follicle and falls out easily. However, alopecia can actually be a symptom of another underlying disorder. An example of this is thallium poisoning. Thallium is a heavy metal used in industrial manufacturing, jewelry, and rodent poison. People exposed to this chemical experience alopecia symptoms, like dramatic hair loss, obviously. Therefore, a blood test is critical to rule out causes of alopecia like heavy metals. Like most diseases, there are many potential risk factors with alopecia. However, the disease is more common in people under the age of 30. Some factors that increase one's risk of developing alopecia is having another family member with premature balding, predisposition for allergic reactions, having another autoimmune disorder such as lupus, and stress. Don't get stressed now about getting stressed. Documented cases of stress-induced alopecia involve a sudden severe acute stress, such as a sudden loss of a family member, personal tragedy, and phobia exposure. This sudden stress is believed to upregulate inflammatory proteins that can destroy the hair follicles. Finally, the part I'm sure you've all been waiting for. Will my hair ever grow back? And what are my treatment options? Before I knew any of these, I always had a rabbit on my head. Why, you may ask? Well, because I wanted a head of hair. Ha ha ha! I kill myself. So back to if my hair will ever grow back. I used to worry a lot, but I've been doing a lot of research and I've been talking to some doctors and discovered some treatment and prevention options. A lot of people use topical steroids to treat their alopecia. It's an ointment applied to the scalp, but unfortunately, less than 20% of patients in the study had long-term hair regrowth. On top of that, a lot of treatments have pretty nasty side effects, like sexual dysfunction, mood disorders, and cancer risks. Personally, none of these sound too great to me. Other topical treatment options do exist with varying success and side effects. These include laser treatments and wrapping your head with a towel filled with medication for 20 minutes. One that stood out to me was a combination of an oral corticosteroid and an ultraviolet therapy. All the patients in the study had terminal hair regrowth. Unfortunately, some hair loss occurred after, but hey, it's progress. This combination therapy could potentially rebalance the immune cells that cause the disease. I'm really excited to see this treatment develop, and hey, it might do something for me. And if medicines don't work, hair transplantation is an amazing option too. you get donor follicles from either the back of your head, where the hair grows the most and the longest, or from the back of a donor's head. Doctors take the strip from the back of the head and slice it down to small individual hair follicles. Then, they make a ton of small nicks in the area of your head to insert the follicles. Over 6 to 8 months, the patient's hair should grow back, which I think is a pretty good deal. Unfortunately, this treatment option can be very pricey. Before I knew about all these options and had a strong sense of self, I was extremely self-conscious, as are a lot of people with AA. This self-consciousness can lead to the development of various mental disorders. 39% of all alopecia patients have major depression, and another 39% have general anxiety disorder. So if you can take anything from the spiel today, it should be to get diagnosed, explore the cause and treatment options, and most importantly, remind yourself that beauty is indeed only skin deep and your hair length does not define your success. Adios!